So this is a case study where we're doing a hump reduction and refinement of the nasal tip. So in the preoperative assessment, you can see that the tip of the nose is somewhat broad and a little bit square shaped or boxy. The skin overlying the tip is medium in thickness, and that's important because some of the maneuvers that we use to narrow the tip are appropriate in thick skin but not in thin skin. In medium skin, there's various options for us in terms of narrowing the tip. So my recommendation for her was, in addition to the hump reduction, was to perform a cephalic trim of her tip cartilages and some dome defining stitches, and I'll show you what that looks like. So on side view, of course, we wanted to take away some of her dorsal hump, but otherwise her tip position was good, and that's different than defining the tip. I think it was rotated away from the lip appropriately, so I didn't really want to change its position, but on front view I wanted to narrow it a little bit. So in terms of the hump reduction, as I've showed you in previous videos, we basically took down a little bit of the bone and cartilage that formed her hump. On front view, this is a diagram sort of illustrating the nasal tip cartilages and where they sit. So we want to narrow those and define them. And the way I do that, in her case, is by removing the back edge of the tip cartilages. That's called the cephalic margin. So we do what's called a cephalic margin trim. That cartilage is removed to make the cartilages thinner. Now, in addition to that, I want to reposition them so that they're narrower and they have a more acute apex. So the way we do that is to take the cephalically trimmed cartilages, which are now narrower, and reposition them so that they form more of an apex or more of a pyramid. And that's done by applying stitches to the apex of the cartilage or the dome area. And that's why we call it a dome defining stitch, because it changes her broad cartilages into narrow, more defined cartilages. So you'll see before and after, the position of the underlying cartilages changes from wide to narrow, and from splayed open to pinched in a more acute angle. And that's the way the cartilages would look schematically underneath the skin. And the actual result, it looks like this. So she goes from having a fairly boxy nasal tip to a much narrow and defined tip. And you'll see that on her other views as well, that her tip is no longer sort of boxy and sort of protruding through the skin like that. It's much softer and narrower. And then again, you can see on her profile view that her bridge has been taken down. So overall, her nose looks a little bit smaller and more refined.